Your equipment. You will need a sterile gown and gloves, as this is a strictly ANTT procedure, a PICC line of suitable size for the weight and gestation of the baby, sterile normal saline, steri strips, and an IV connector. A PICC pack contains the drapes, sterile swabs, forceps, tape measure, and clear transparent dressings. Examine the baby for suitable insertion sites, preferred sites or visible veins in the antecubital fossa or the long saphenous vein. For arm lines, measure from the insertion site to the sternal notch. For leg lines, measure from the insertion site to the umbilicus. If you are using the antecubital fossa, turn the baby's head towards the limb to reduce the risk of it entering the jugular vein. Put down sterile drapes and clean the whole limb of the chosen insertion area. Allow to dry and place the limb through a clear plastic sterile field. Flush the PICC line, extension set and IV connector with sterile normal saline. You can see there is a firm but delicate rod at the distal end of the PICC line. Carefully pull this through the blue plastic attachment so that it remains within the casing but it is not poking through the distal end. Attach the extension set and IV connector to the blue casing and flush with normal saline. Take great care not to fracture the rod. There are markings on the PICC line at 5 cm intervals so that you are able to see how far you have inserted the PICC line. Apply a tourniquet to the limb with only minimal tightness. Take care not to fully occlude the limb or damage the skin. Slowly and carefully insert the needle introducer into the vein. This is a large bore needle and may bleed significantly. Using the forceps in the PICC pack, grip the top of the PICC line and continually feed it through the introducer needle. There may be some resistance, but it should advance reasonably freely. Flush the catheter with sterile normal saline. As the lumen is very small, a 1 or 2.5 ml syringe may be easier for this. It should flush easily, but may not bleed back due to the narrow lumen. Slowly and carefully remove the introducer needle from the skin and slowly slide it over the PICC line, taking care to ensure that the PICC is not pulled out. If your introducer needle is of the splitting type, remove it carefully from within the skin and pull it apart on both sides. The needle will split in half, which makes removal easier. There is often significant blood ooze following this procedure. Gently apply pressure with a sterile swab from the PICC pack. Be patient and don't apply the dressing until the ooze is fully stopped. Caltostat swabs can be used if this is very excessive. Once the blood ooze has stopped and the area is very dry, carefully apply steri strips over the insertion site. Gently and loosely coil the excess PICC line around the insertion site, leaving a small amount of free line with the IV connector. Apply the clear dressing over the area and flush to ensure patency. Take care not to encircle the limb with the steri strip. Place a small amount of gauze under the IV connector to protect the skin and make sure there are no kinks in the PICC line. Perform an X-ray which includes the limb of the target insertion area. The tip of the PICC line should be visible in a large vein outside the heart with no loops or buckling, which suggests misplacement.